Welcome to the ACOI Resident Lecture Series. My name is Kyle Clausen, and we are going to be doing a three-part series on physician contracts. This first part is on contract risk, and each part will take roughly 10 or 15 minutes to go through, and you'll have an email address at the end to send specific questions to should you have them. So, getting started, I want to tell you a little bit about myself, my background, and how we interact with ACOI. Again, my name is Kyle Clausen. I'm an attorney. I've been practicing as a healthcare attorney for 15 plus years. I'm also the CEO of Resolve. And if you're not familiar with Resolve, the website is right below my image here. It's a platform designed to help you specifically on evaluating and negotiating physician contracts, getting you access to all the risk factors that you would find important and also compensation data that you would need. I've negotiated 10,000 plus physician contracts. Our team works with thousands of physicians every year. I'm married to a physician, and so this topic is obviously very near and dear to my heart. We're also a member benefit of ACOI, and what that means for you is that you get a discount on any of the services or platform fees that you may need as you negotiate your contracts coming out of training. So that as the background, we're going to get started with the question of what's worth roughly $3.5 million to you. And spoiler alert, it's your contract. And it's not because of what you earn every year. It's because if you do this the wrong way, and if you miss out on value or you cause yourself additional risk, that's the monetary value for a physician missing out on those details in their contract. So when we talk about contract risk, and that's what this first part is about, it's really important to understand why risk matters and what matters to physicians. And the chart that you're looking at here on this slide is part of a report that was done by Bain. And Bain is a large consulting company. They surveyed physicians and were asking about what drives satisfaction. And I think as you look at this chart, it's really interesting because if you look top left, things like compensation, staffing, and workload, both have low levels of satisfaction attached to them, okay, with a huge opportunity to delight right at that 60 to 70% range at the bottom. Other things that are listed on here is autonomy, job responsibilities. Both of those are medium levels of satisfaction. And interestingly, nothing on this chart has a red dot, which means there's no high level of satisfaction. And the reason I think that's important is because most of these pieces can be solved contractually. Your compensation is a term of your contract. How much autonomy you have is likely going to depend on who you work for. Your staffing, workload, right? Leadership alignment, all those things are going to be dictated by your contract. And so when we think about getting into a good contract, one of the things that matters is who you're going to go to work for, okay? And I'm not here to tell you that you should go into private practice or work for a hospital, health system, an academic center, or a practice that's owned by private equity. You may run into all of those in the market. Each of them are going to come with different contractual factors. Most private practice contracts that we see fall into this kind of bottom right quadrant of this matrix. They have lower guarantees, but they provide more upside, right? Autonomy, ancillary revenues downstream, okay? As opposed to the rest of those employers, private equity, hospitals, health systems, academic centers, you're going to get higher guarantees, usually a little bit more robust benefit packages. But at the same time, you're losing control and you're giving up any downstream access to ancillary revenues. And so, again, I'm not trying to tell you that any of these are better or worse. Some of this is personality type and what you want out of your career, but you certainly want to push your contractual terms as high, to the top and to the right of this as possible. You want as much guaranteed with as little risk and as much autonomy and upside. Okay, and so that's our goal as we work through this three-part series. Okay, so the goal today is to talk about contract risk and to hopefully help you identify where that risk falls in your contract. Different categories have different values. Compensation is all what we're going to talk about in series 2 or part 2 of this. So for now, let's talk about your scheduling and duties and also your termination provisions and why these matter a lot in your contract. Okay, so when we looked at that very first chart by Bain, dissatisfaction was coming up from job responsibilities. Okay, that's all of the things in this left-hand column. Where you're going to go to work, how many days of the week you're going to work, how much call you're going to take, if you're allowed to perform outside activities or not, or side gigs, and we'll talk about that specifically in a second. If you retain any intellectual property rights, if you have to supervise APPs, right, mid-levels, that should be dictated by your contract. And then also if you need time allocations for administrative time, research, etc. All of these things are going to show up in your contract, and generally what we see as a starting point is they're very broad. okay? And they're usually fairly employer favorable from the language. It's going to say things like you're going to work at the locations that we dictate by address, and then any other location that we may have, okay? Well, that catch-all at the end of that sentence of any other location really means you're going to work anywhere they tell you to. And if you're buying a house in a certain spot because you only want to work at one clinic location or one hospital, but they have 5 or 6, it's not uncommon, and a complaint that some of our clients will have that come to us, after the fact, and they'll say, I'm being asked to satellite now, right? And I didn't negotiate that in my contract, and so it looks like I'm allowed, or they're allowed rather, to move me around, and that's going to cause me to have to leave this job. Okay, these are outcomes that we don't want. Same thing with call. We find a lot of specialties are promised call at certain rates, maybe 1 in 4 or 1 in 5, only to find out that 2 or 3 people are leaving, someone retires, those things happen, and all of a sudden you're on call 1 and 2. Depending on how heavy the call load is, that can really, change the job, and maybe a job that you wouldn't have taken, if you would have known that going in. So everything in that left-hand column, scheduling, duties, responsibilities, you need to make sure you're reviewing, make sure you're identifying what's important to you, and making sure it fits your situation, okay? The second thing from a contract risk standpoint is anything that touches on termination. You need to think about leaving the first job at the same time you're signing the contract. It's kind of like planning the divorce with the marriage. A lot of people will have prenuptial agreements. This is the same type of thing. We need to plan and understand if this doesn't work out in the future for any reason. Maybe there's a breach of contract, right? And somebody did something wrong. But more commonly, it's no one did anything wrong, and I just need to give notice, right, that I need to leave. It's called a without cause termination. Most contracts are going to have between 2 and 4 months of notice attached to them. You need to understand that and how to deliver that notice. And then once you've triggered the termination, there's a couple of financial pieces to think about. The first one is your malpractice insurance and tail coverage. Okay, and if you're not familiar with tail coverage, essentially what that means is that if a patient sues you after you've left, you need to know whether or not that insurance policy still covers you for that lawsuit that came in post-termination. If you're on a claims-made policy, the answer is it does not, and therefore you need to go buy tail. Tail can be anywhere from a fairly small cost, right, at $5,000 to $10,000. It can be a very large cost. Some specialties over 6 figures, right? And so knowing your specialty, knowing your location, and understanding that cost is really important. Hopefully your employer is going to be paying for that on the way out. If they're not paying for it, we sometimes will see vesting schedules, right, where there's shared costs. Sometimes it depends on who terminates the contract. There's different ways to soften that language, but it's certainly a major cost that you don't want to miss. The other financial piece is if you taken any type of upfront signing bonus, relocation allowance, student loan forgiveness, those things are generally tied to years of service. And so you need to understand when and how those are paid back. You need to understand if the taxes have been withheld or if they haven't, and knowing just what your obligation is going to look like if you need to terminate early, which hopefully doesn't happen, okay? Outside of the financial pieces, you also need to pay attention to non-competes. And I want to talk to you about this specifically because this is a really, I think, popular topic in the last couple of years. The FTC came out with a ruling that said they were going to ban non-competes, and I think a lot of physicians thought that ruling is just what's in place. It has since been overturned, and the FTC has not appealed that. They've stayed their appeal at this point. So as of today, each state can decide whether or not non-competes are allowed, okay? And so they have to be reasonable, and they have to be reasonable on these categories on the left-hand side, the bullets, on the time frame they restrict you from practicing, the restricted area, meaning geographic size, what the scope is it just internal medicine, is it your fellowship, right? What are they preventing you from doing? And then also it has to be reasonable on if there's any exclusions, meaning if they terminate you without cause, if the private practice gets bought out by private equity, there's different triggers that you would expect to release you from a non-compete. And so a court would look at that in total and say, is this reasonable or not, if we need to enforce it? The FTC thinks that this is a major value point, potentially reducing your compensation by 37% if you have a non-compete that prevents you from renegotiating and having leverage to move around mid-career, okay? And so on an average physician salary, that's roughly $111,000 per year or $9.3 million over your career that you may lose in career earnings because you're unable to renegotiate because you're stuck with a non-compete that you can't get out of, okay? So please make sure, especially with the expansion of health systems now in any practice, that you understand where it's applying from. The graphic here on this slide shows 4 or 5 circles. It's not uncommon to see non-competes being applied. Let's say it's a 5-mile radius from every single location. So a 5 mile non-compete really turns into a 25 or a 30 mile non-compete fairly quickly. So we'd encourage you to limit these to just your primary location as well. Okay, so non-compete's extremely important. The last piece that I think is becoming more popular is the ability to work as a side gig, okay? To pick up consulting shifts, to be an expert witness, to do things that are what we would consider inside medicine. And so the charts at the bottom here on the left, these are kind of frequency rates of physicians that want to do something outside of their main job. Consulting is the most common, right? But you can see the other categories there. Outside of medicine, things like investing in real estate, right? Teaching, writing books. You need to be careful because most contracts are going to start out saying that you're not allowed to do any type of outside activity unless the employer gives their written consent. And so with the occurrence rate of more and more physicians wanting to do a side gig, we find that this paragraph is extremely important. Why are physicians looking for side gigs? Again, the survey says that it's really just to earn extra compensation, okay? And so if compensation is important to you, I would encourage you to stay tuned, right? For Series 2, we're going to talk about how you'll get paid, how to evaluate compensation, and what to look for to make sure it's fair. So we're going to end part 1 here on contract risk. My email is listed below. The website's there as well. You can use the chat feature if you need to, and we will see you on part 2, hopefully, to talk about compensation.